Hello and welcome everybody. I am Jodi Hillmer, Director of Patient Care Services at CentraCare Health Long Prairie, and I am here to present to you my idea to implement a nurse practitioner at CentraCare Health Long Prairie. The objectives of my presentation are to implement a hospitalist program using a nurse practitioner, review current and desired state of CentraCare Health Long Prairie, state the goals of implementing a nurse practitioner, and review the benefits of implementing a nurse practitioner program at CentraCare Health Long Prairie. The current state at CentraCare Health Long Prairie is that we have 4 primary care family practice physicians. One physician has cut back to part-time and will be retiring in 1 year. One physician has cut back to part-time and was also diagnosed with cancer in the past 6 months. We are unable to recruit family practice physicians. This has been a long-term issue for Long Prairie. 2 physicians were recruited in the past 2 years. 1 left already. We are also unable to retain family practice physicians. 8 family practice physicians have left in the last 10 years. What we have heard from them is the demands in a rural setting are just too much. So they can't do it all. The shortage of primary care physicians in rural areas, especially family practice, has been a serious problem for decades, with major implications in access to health care for a substantial portion of the U.S. population. Retention is a key component of the rural physician supply, in part because it has an impact on the rural workforce. For example, one physician practicing in the same rural area during a 35-year career has a similar impact as 5 physicians who practice for an average duration of 7 years. So what that means for us is our long-term physicians are going to be very hard to replace. So what's the answer? Some of our current challenges include recruitment and retaining family practice physicians, patient access, using locum providers to fill the gaps, which is not a long-term solution, falling patient satisfaction scores, especially the physician scores, due to physicians do not have enough time to pay the attention needed to hospitalized patients. Decreasing inpatient census is another area that we have a challenge with. Our current average daily census is 5.8, which has been consistently trending down, and physician burnout. Currently, we are seeing an average of 900 physician visits a month in the clinic. That number includes the assistance of 2 full-time locum providers. By adding a nurse practitioner as a hospitalist, the goal would be to increase that number by 10% in the first 3 months, resulting in about an average of 100 more patients a month. Burnout is a syndrome that is characterized by exhaustion, losing enthusiasm for work, and depersonalization, which is viewing people and treating people as objects. We don't want to get there in our 4 physicians that we have, so we need to do something about this. Work-life balance is harder to achieve in a rural setting where resources are limited and demands are high. So what's the solution? I believe the solution is to implement a nurse practitioner hospitalist program. Using a nurse practitioner in the hospital role would alleviate many of the duties that the physicians are burdened with today, including hospital admissions from the clinic and the emergency room, hospital discharges, transitional care admits, committees and teams such as patient satisfaction, quality, pharmacy, and therapeutics. Increasing the nurse practitioner workforce is one way of expanding primary care. Primary care makes sense for it to be done by nurse practitioners because they can be educated more quickly than primary care physicians, and because, according to studies, nurse practitioners provide comparable quality care in the primary care setting. Desired outcomes. Financial gains. There are some financial gains that we could recoup from having a nurse practitioner program. By keeping the physicians in the clinic seeing patients, the organization will gain revenue. Using a nurse practitioner versus physicians is a salary difference of approximately $85,000. We could increase physician satisfaction. They would be able to focus on clinic and have a work-life balance. We could improve recruitment and retainment in the family practice physicians. We could also improve staff satisfaction by having one go-to person for them to confirm orders and issues on hospitalized patients. We could increase patient satisfaction by having more time and attention paid to patients by a nurse practitioner. Studies have shown potential savings from increased use of nurse practitioners and physician assistants. In 2009, the average cost of a nurse practitioner visit was 20% less than that of a physician. Medicare and Medicaid reimbursement rate for nurse practitioners is 85% of what a physician receives for providing the same service. Due to these lower levels of reimbursement, studies identify that fully utilizing nurse practitioners to reduce primary care costs by 20% would reduce primary care costs by 20%, an annual savings of up to $8.75 billion. So this just makes sense. Where do we go from here? My suggestion is that we implement a nurse practitioner hospitalist program. It is the future of Center Care Health, Long Prairie. Any questions?
Yes. Is the hospitalist program being implemented throughout the healthcare industry or being looked at, or is it just our regional sites?
It actually is, because of what I talked about on the reimbursement side. Many rural healthcare facilities are looking at this program to reduce cost and alleviate physician burnout. So yes, it's being used widely, and more over the last couple of years. Partly because nurse practitioner guidelines have really lightened up, and they are now able to provide care without having a physician backing them up. So they're more independent now, and that's just changed within the last 2 years.
Are Medicare and Medicaid looking to increase the reimbursement rates from 85% to higher in the future?
You know, I don't think so. I don't know the answer to that completely, but it would make sense for them not to, because it's saving them a lot of money. And also, rural sites or critical access sites can recoup that cost on their cost report at the end of the year. So for rural sites, it makes sense for them to use a nurse practitioner versus a physician, even though the reimbursement is less. Good question. Thank you.